Hey guys, good evening. Good evening. I just turn on the lights. Okay, so let me go live on Facebook. Yeah. Hi. Hello guys. Good evening. Good evening. So I'm live on Facebook and I'm live on Instagram, and I would like to pin up my. Let me pick my topic. I care. What's that? Eyecare, okay. Online. Episode 13. Episode 13. Okay, I'm trying to get this sorted out. Alright. Did they still do that pinning thing that they do on Instagram? Let me see. Okay, pin comment. All right, so it's done. Hi everyone, good evening, and welcome to Eyecare Online episode 13. Yes, this is our 13th episode, and it's been I want to say it's been fun, but has it really been fun? It's been fun, and at the same time it's been work, like hard work, guys. Trying to read, trying to kind of have as many information as possible to share with you guys and all that. So it's been fun and it's been work, but altogether I have been loving the experience, because one thing that this program have actually done for me is that it has made me a better doctor, right? Because I find myself reading, I find myself subscribing to articles, like even things that are not yet in Nigeria. I kind of have access to some information and all that. So it's been good, right? But I have to keep reading and studying and learning and I'm loving it. So thanks to you guys. So this is episode 13, and I must say that this episode is going to be super amazing, because I'm going to be talking about different things. I'm going to be answering 3 questions. I have 3 questions here, like we usually do. I'll answer 3 questions and I'll go into our main topic, which is refractive errors, right? Refractive error, when we talk about things like short-sightedness, long-sightedness, I cannot read my Bible anymore, astigmatism, that's what I mean by refractive errors. All right, so I'm going to be answering the 3 questions I selected from the list of questions I have, and then I will now go into the main topic of today. All right, so the first question is from Ella. Ella said, "Please doc, I do experience itching a lot, and when it comes, I likely dip my face in water. Is it good?" Okay, so before I answer this, I made a post earlier today on home remedies, right, that will help you relieve itching. Now, these home remedies are actually the things that you can do, if you should do if you don't have access to the hospital, the clinic, or a pharmacy to get the actual medication, right? So one of the things I mentioned was washing your face in running water. Now, one thing I realized is that when you are experiencing itching, because most times I use myself as example, and then of course with other research materials and all that, I experiment a lot of things on myself. I've used many different eye drops just to know how they feel, so that when a patient tells me that I gave her an eye drop and she's feeling this way, I can have an idea of what she's talking about. So this particular, I usually struggle with itching also, because I have astigmatism. I'll talk about astigmatism later when I'm talking about refractive errors. So I have astigmatism, so I also struggle with itching. And whenever I have this urge to scratch, and I wash my face with water, running water, the coolness of the water kind of reduces that urge to actually scratch. And that's why when I talked about the tea bag, this sliced cucumber, I emphasize on the coolness. It has to be cold, okay? But dipping your eye inside water is really not good, because the truth is, if it keeps happening like that, that means there is something triggering it. This water stuff is supposed to be a short-term thing, just to give you that relief at that time. If you are having consistent itching, if you read my post, talk about it could be things like maybe man gland disease, dry eyes, refractive error. You need to find out, identify exactly what is causing you to itch. Identify what it is, and then you handle it, you treat it. Itching is not a disease on its own, it's a sign, or rather it's a symptom of a problem. Itching is is not a diagnosis. Itching is a symptom to a problem. So if you keep ignoring that, if you don't actually take care of what that problem is, you will keep having itching. So my advice to you, Ella, is to get yourself to a clinic. Let them actually run a test on you. Let them examine your eye and be able to diagnose you properly, so that if the reason why you are having itching is due to dry eyes, they actually treat the dry eyes. If it's due to meibomian gland disease, they treat it. If it's due to allergic conjunctivitis, they will help you to identify what you are allergic to. And if it is due to a refractive error, you get the glasses. If I go for 3-4 days without wearing my glasses, I'll be experiencing severe itching on one eye. And even if I put an eye drop, the eye drop will just give me a little relief for for a few minutes or an hour. But if I don't wear my glasses, the itching comes back. So itching on its own is not a diagnosis. It is a symptom to a problem. So identify what the problem is and solve it at the root. Okay, so putting your face inside water to wash your eye because you are itching, it's not a good thing. It's not. So Ella, I hope you got that. The second person is Mary. Mary said, I have difficulty in sighting even though I'm using glasses. Okay, now let me say this, because when I'm talking about refractive error, maybe a bit clearer. When you get glasses, if you go to a clinic and they give you a pair of glasses, right? Let's say you're having issues with your sight in the first place, and you now go to the hospital and they give you a pair of glasses and you are still struggling with that problem, please go back to that clinic. Your glasses is supposed to improve your vision. Your glasses is supposed to help you see better. Your glasses is supposed to help you feel better, see better, and all that. If you're not getting the results that you desire from your glasses, please. There are rare occasions where the glasses doesn't actually give you the exact result that you hoped. Now, you have to understand that there's a difference between expectation and reality. If there's some people that have such a very high power and then they can barely see with their ordinary eye, and you now put glasses and they're able to see small, now they will have this high expectation that they need, that they should be seeing everything. In most cases, that expectation is unfounded. It cannot be met, right? So what you need to do is to find out, is to know exactly what your challenge is. If your prescription is a very high-powered prescription that requires that the vision or the correction or the glasses will not give you 100% vision, but can give you like 40-50%. That is why when I'm seeing my patients, and from the beginning, I try to manage their expectation depending on their case. If the patient has glaucoma and some part of the eye, vision is lost, I'll make them understand that no matter what we do, we cannot recover the lost vision. The reason is that vision lost due to glaucoma is irreversible. So by the time I manage their expectation, that even if I tell them that your vision is going to improve by 40% and we'll end up getting it to 60%, they are happy with it. So Mary, the first thing we need to understand is, what is the diagnosis? What kind of eye problem or refractive error are you struggling with? And that will help us to know what you need to do. But if you are not getting the desired result from your glasses, please go back to the clinic. Then the third question we're handling, and the last question, is by Willem. Willem complains of seeing stars and halos from incoming cars at night. Now, there's something called light sensitivity, right? Some people, when they look at light and they close their eyes, they see these halos, flashes of light and all that. Well, there's some people that struggle with driving at night because of this light matter and all that. When there is headlight. Now, the challenge is that photosensitivity on its own, again, is not a diagnosis, right? Yeah, some people react to light and all that, but sometimes it's always attached to something. Either it's attached to a refractive error or it's attached to a disease. People that have glaucoma, they definitely react to light. People that have cataract, they react to light. So the problem is being able to identify exactly what the problem is. Some of the things that we struggle with are not actually the problem. They are just the signs or symptoms to tell us that there is a problem. But the mistake we make is that we look at them as a diagnosis on its own, and then we do not treat the actual problem. We start looking for what I call a band-aid. Your eye is itching you. You've not been able to find out exactly why is my eye itching me, but every time you're putting something in your eye. I had a case where somebody actually applied Aboniki in the eye because of itching. Yes, she applied Aboniki in the eye, and the good part, or that will I say, what really saved her was before the Aboniki could enter the eye, the heat alone from it was enough. So she ended up touching it, just putting it like kind of a little bit, you know, below her. But that alone, by the time she got herself to the clinic, her eyes were swollen. You do not just instill things that people tell you. Somebody will tell you, put urine in your eye to take care of this. Put scent leaf. I have seen cases where people put scent leaf in their eye. Put scent leaf, put cassava stem. You know, when you remove cassava, that white stain. People have destroyed their cornea, the black part of their eye, because they are trying to take care of a symptom. You don't do that. You don't instill things that are not prescribed. I know about old wives' tales. I remember growing up myself. I remember when my mom then will go to one of my old aunts then, and she will get a bottle of something that they say is for eye. And then we'll drop it in the eye and we'll put some in our mouth and we'll hold it. After close our eyes, after 5-10 minutes, you spit it out and you see some things moving inside the whatever, and they will tell you it's a worm from the eye. I experienced it too. But now we know better. And you know the interesting thing, after putting that, the itching will stop. The itching will stop for a couple of days, a couple of weeks, and it will come back. Little did my mom know then that I had astigmatism, and we kept putting those things in my eyes. And heaven knows, I don't really know. I hope nothing goes wrong in the eye, because we don't have any research to, you know, to back this up that it actually works. We get relieved. But what happens to our eye in the long run? So please, I want to plead with you guys. When you are having a sign or a symptom, what it is a sign or a symptom. It's not a diagnosis. It's not time for you to wait for your neighbor to tell you what to do. It's not time for you to wait for your great-grand-aunt to tell you what to do. It's time for you to seek the right help. So please stop instilling things that are not prescribed by a doctor in your eye. Stop playing with your eyes. We don't have a spare eye in any bank. Nobody has a spare eye somewhere that they are keeping, that if this other one goes bad, that they can replace it. It doesn't work that way. When your eye is gone, it's gone. So the best thing you can do for it is do not sacrifice your eyes. Please don't. All right? So I hope that this has really helped to answer these questions. Don't just instill anything into your eye that's not been prescribed. Okay? There's a reason for that. So those are the last 3 questions, the 2 questions I'm going to take tonight. Okay, and Instagram, I'm saying, tell me, how you doing? Good evening. It's been a long time. Favored, good evening. Thank you for joining us. All right, so let's talk about refractive errors. What are refractive errors? Now, I'm going to be talking about, how many? 4 types of refractive errors. We have more than 4, but these are the 4 most common types of refractive errors that we experience. So I'm going to try as much as possible to break it down, to make it in a way that we can easily understand them, right? Okay, so the first one is myopia, short-sightedness, right? Those people that you see, they can read, no matter how tiny the article is, they can read it. But when it comes to seeing things as far, they struggle. This is something that we see among kids. Some kids, you know, actually experience myopia, short-sightedness. You find them going straight to the close to television to see television. You see them carrying book like this to read. When they're in classroom, they have to copy from their classmates and all that. Adults also struggle from this. But with the recent lockdown and all that, and then the high increase in device use and phone use, found out that children that spend more time on phones stand a chance of actually having eye problem. That is why prolonged staying on screen for so long for kids is not the best thing for them. You have to help them because they really can't help themselves. So we'll talk about that a different day. But the point is, when it comes to short-sightedness, what it simply means, it's not a disease. I need to be clear about this. There is no eye drop right now. There are some that are still trying to research on, but there's no eye drop right now that can actually prevent you from having myopia, short-sightedness. Okay, there is not. So what we do is when you have short-sightedness, we give you glasses. Now, what causes that is that the length of the eyeball is supposed to be like this, for example, but in case of short-sightedness, it's longer than normal. So because it's longer than normal, instead of the image forming where it's supposed to form, it forms before, right? So you find out that the person, for the person to see you clearly, they have to come close to you so that your image can be pushed to the back, which is on the retina. So short-sightedness is not a disease, it's a condition. Many times when you have someone that is short-sighted, look at the person's family tree. Either the mom, the grandparents, the dad, the grandparents, aunt, uncle, somebody in the family tree actually has, myopia. And the same thing with hyperopia, the second one, long-sightedness. Those, they can't see things as far, they can't even see near. Right? And in the same case, it's opposite of myopia. The eyeball is small, so the image is formed behind instead of on the retina, is formed behind. Both cases are conditions, they are not diseases. But we have more prevalence of short-sighted than we have long-sighted. But they are both still, existent. They are both existing and they are both a problem. When you go to a clinic and you're told that you are long-sighted or you're short-sighted, right? What it means that you're going to get glasses. Now, insisting on getting an eye drop for them is not going to help you. You are simply going to enrich the clinic. Because what you need are glasses. You don't need an eye drop for hyperopia or myopia. Okay, now unless you are, okay, that one is not for you guys, because unless you're a child, then there is a drug treatment management for that for kids, but for adults there isn't. Okay, so these are the two conditions, these are two classes of refractive error: short-sighted, long-sighted. Both of them you require glasses. Clear cut. Now they are of different degrees. You have the mild one, the moderate, and the high. Now let me answer a question. Please don't forget, you can ask your question right here. You can ask your question. If you have a question, you can ask, and I will answer. As long as it has to do with the topic I'm discussing, I'm going to answer that. Now, many people come to me, and when they come to the clinic, they will tell me, let's say the person is 25, and they say, so if I start wearing glasses now, it's going to correct. Now let me say this. For your glasses or for your eyes to correct through the use of glasses, there are parameters or factors that you have to consider. We have to consider your age. We have to consider the power of your prescription. If you are between, the age of 2 to 12 or 13, chances of the eye correcting is high. If you are between the age of 13 to 19, okay, it can still correct. Anything above 19, you're gonna wear glasses. That's glasses. The only thing that the power can change. Now, another factor that determines if you're going to drop the glasses or not, aside from your age, is the prescription itself, the power itself. There is a particular amount of power, will I call it an amount? Like example, if your power is less than 1, whether it's +1, -1, chances of you dropping the glasses is higher. Anything above 1 is more difficult, and it's more possible when it comes to minus. When it comes to plus, not really. Okay, so if you are 25 or 30 and you get glasses, and someone tells you that is going to, after wearing it for 6 months to 1 year, you're going to drop it, not really. But sometimes I realize that some doctors who just want to tell you what you want to hear so that they can have peace at that time. Okay, so let me just tell you now, the glasses you're wearing is the correction that you need. That is it. The glasses you're wearing is the correction. As long as you are above the age of 19, 20, the glasses you're wearing, that is the correction. Okay, so now the third class of or type of refractive error I want to talk about that is not so common, but it's still common. People don't talk about that much. It's called astigmatism, which is where I fall in. Astigmatism is not that we cannot see things afar. We can, but it's blurred. All right, it has to do with the curvature that this black part, I'm trying to explain it in a very simple way. The black part of the eye does not have, it's not equal. Let me put it that way. It's not equal, something like that, right? It's not equal. So you found out that for some of us, we have issues looking at either vertical line or horizontal line. All right, so that is it. So astigmatism is not that we can't see things as far, it's just that it's not blurred, it's not clear, it's blurred. So by the time you give us a prescription, it has to be in a particular, either in 180 meridian or 90 meridian, or it can be in an oblique meridian. For those of us that did physics, okay? So that is it. So astigmatism is another common type of refractive error. Now you can be short-sighted and still have astigmatism. You can be long-sighted and still have astigmatism. Okay, we can have a combination of short-sighted astigmatism, you know, and then it can also be on its own. If you put me in a room like this, I am fine. But when you take me outside and I have to look far, everything kind of is a little bit blurred. So that's why some people, when they see me in the room, they'll be like, doctor, you're not wearing glasses. I'll be like, I wear glasses. And they say, why are you not wearing it here? I'll tell them, I'm fine in here. But take me out. Hi, Doris. How you doing? Take me out where I need to look far. That's when I need to get my glasses. So, we've talked about short-sightedness, long-sightedness, and astigmatism. Now, the fourth one I want to talk about tonight, which is the last one, is what we call presbyopia, inability to read Bible. Those of us that are approaching our 40s now, from 37, 38, 39, 40, 41, you found out that the tiny things you could read before, you can no longer read them. You have to move them further and further and further away. That has to do with age. It doesn't have to do with any other thing. It's not by whether my great-grandfather lived to be 100 and he never wore glasses. It's not like my parents are 95, they don't use glasses. It has to do with age. Now, when I have a patient that is about 38, 39, and I tell the patient that you need to start using glasses to see, and the patient tells me that no, that why do I need to use glasses to see? The simple explanation I usually give them is this: consider your eye muscles like your skin. The way your skin is now at 38 is not the way your skin was at 22. As we get older, so does our skin. So as we get older, so does our eyes. The ability for our eyes to constrict to see tiny print and to relax to see far, it begins to lose that. And when your eye begins to lose that ability, you find out that you keep moving things further away so that you can see them. There is nothing absolutely wrong with it. You can't stop it, but you can actually delay it. You can delay, right? You can delay it a little bit by your diet, your eye exercises. There was a day I went out to eat, you know, and I found myself waiting for my meal. So I took my pen, sorry, 1 minute. I took my pen and I was doing my eye exercise because I just like doing it, you know, and I was doing eye exercise and all that. And somebody was looking at me and the guy asked, what are you doing? I told him I'm doing my eye exercises. So he now said, why? What's the point? And I said, first of all, when I do my eye exercise, I can work on my laptop, even though I'm using my blue cut lens, you know, for a longer time. And then I can delay the getting into that age of needing glasses. Okay? I can delay it a bit. Because at the end of the day, your eyes they have muscles. You need to exercise the muscles. There's a video I did on eye exercise, eye yoga, that you can actually do to delay this. Alright, so you can find it. It's actually on Instagram, so you can see it on Instagram because that's where I post most of the videos. So you can check it out on Instagram or on TikTok. I put them up. Do eye exercises. Alright, this can actually help you to delay the presbyopia, the needing glasses to read. But eventually you are going to use one. And then let me also say something. There are certain people that get into this age. Like for example, let's say I'm 38 years. I can be 38 years and not need reading glasses, and you're 38 and you need reading glasses. Now you have to look at our lifestyle. If you are a teacher or a tailor or someone that deals with near print, you're always dealing with near print, you definitely need the glasses before I do. Let's say I'm a trader, I'm always dealing with things at far. I'm a seller, I'm always looking far, right? I may not even need glasses until I'm 45, 50. But you can need it at 38, 39. It has to do with your lifestyle also. So your vocation, your lifestyle can actually determine when you can become presbyopic. So those are the 4 types of refractive error I want us to discuss, to talk about: the short-sightedness, the long-sightedness, the astigmatism, and then the presbyopia. So when you go for your eye examination and the doctor tells you that you need to wear glasses, it's important that you ask the doctor, what is my diagnosis? What is my diagnosis? And a proper eye clinic will not tell you you are wearing number 1.7, 1.5. We don't do that. We tell you whether you are wearing, we'll give you the number and we'll tell you whether it's a diopter sphere or cylinder. Because that will help us to know, that will help any doctor to know whether this person is either short-sighted, long-sighted, or astigmatic. Alright, so those people that go to market and they just do trial and error, and they come and tell us, oh, I have my prescription, it's plus 175, is plus 2, it's not the same. Hi Cosmos, good evening, thank you for joining. Hi Elto Binabife, hi, how you doing? It's not the same. And please guys, always ask your doctor, what is my diagnosis? Not every clinic will be willing to give you the prescription, but at least you should know what your diagnosis is. There are other refractive errors that we have. We have convergence insufficiency, divergence, blah, 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 and the rest of them. There are lots. There's a lot when it comes to the eyes. These are just the 4 common ones. The 4 common ones. If you want to know the rest, you can go to school and read optometry. I'm just kidding. Alright, but these are the 4 common ones. You don't know, it gladdens my heart when somebody comes to the clinic and say, doc, maybe they want to have their eyes checked and be like, I went to this clinic and I was told I am short-sighted, or I was told I have myopia, I have hyperopia. It means you know your challenge, because I feel that when you know what you are treating, you stand a better chance at getting better at it, because you know what to do and what not to do to help your situation. So ladies and gentlemen, I hope we are learning tonight. Hi OBBK, thank you for joining. From Instagram, we are improving. This is my 2nd episode on Instagram. Okay, so Doris, Cosmos, I don't know if you guys have questions. I hope we are getting value. So when you go for any test, make sure you talk with your doctor. All right, if you can't ask the question, come and ask me and I'll definitely answer. All right, so any question? Okay, I forgot to mention something. When you have short-sightedness, should I say it? When you have short-sightedness, that's when we use a minus lens, right? When you have, I think, is it necessary to mention that? Because so I do not confuse you guys, right? Let me just leave it. Okay, because they know what to do to use to correct that. But the point is, we use lens to correct it. You need to get glasses. Okay, so one of the episodes I'll talk about different types of lenses so that you can know the best one for you based on your visual lifestyle and what your eye needs. Any question for me? Oh, well done. Thank you, Lillian. Thank you so much. Thank you. Instagram, any question? Thank you so much. Thank you for tuning in. Thank you for tuning in to Eyecare Online episode 13. One day we'll keep doing this and one day will be episode 1000. That's huge. Thank you guys, thank you so much. So don't forget to drop your question. If you have question, to drop it and I'll definitely answer. Yes, and then before I clock off, somebody made a comment in the post I made today about home remedies for itching eye, and the person said that she uses coconut water. Personally, I don't understand that, and I began to research immediately. I know that coconut water is very good for the body. I know that it contains vitamin C, magnesium, calcium, potassium, so many amazing nutrients. It's very good. But can you, I don't know, the idea of putting it in my eye is a problem. And I've asked a few of my colleagues, they don't know what I'm talking about. I was even sounding like a very crazy person. So I want to ask you guys, and if you can drop in the comment section or send me a message, have you heard something like that? Have you used it? Do you know who used it? Did it work? Right? Because this is how we learn. I am still trying to gather information on that from, you know, from my professional colleagues, but I need to hear from you. So please help me out here. Coconut water in the eye, how does that work? For me, I don't know. So thank you so much for watching, and let's have a good night rest. Bye. Okay, let me end Instagram first. And all right, good night, guys.